Macroscopic meat inspection of cattle, as demonstrated here, commences with a general survey of carcass and organs. We must differentiate between the mandatory basic inspection and a more detailed one if required. Male animals can be identified by the ischiocavernosus muscle, the pelvic symphysis and the pubic tubercle, the almost triangular shape of the adductor muscles, and the inguinal canal. In contrast, cows possess a straighter and more planar pelvic floor, and the adductor muscles are bean-shaped. Additionally, we look at the location where the udder was attached. Following the general survey, we commence with the examination of the head. Here we have to pay particular attention to the trimming of the head and its cleanliness. The tongue is inspected and palpated. In order to get access to the retropharyngeal lymph nodes, we have to remove the tonsils. Subsequently, the medial retropharyngeal lymph nodes are incised. Having replaced the tongue in its natural position, we locate the vascular groove as part of the ventral border of the mandible. There we can find the mandibular lymph nodes, which we inspect and incise simultaneously. Now we look for the lateral retropharyngeal lymph node, positioned between the pharynx and the occipital bone. This lymph node may also be located on the carcass near the atlas wing, depending on the trimming procedure. The tissue must be checked carefully, and the lymph node is incised. The muscles on both sides of the mandible are examined for the presence of Cysticercus bovis. In the process, the cuts are extended up to the facial crest and to the temporal process. If this has been done correctly, we automatically find the parotid lymph node, which we incise. Additionally, a longitudinal cut into the sublingual muscles is performed. This must be done without damaging the tongue itself. The plucks are inspected as a whole: pharynx and thyroid gland, trachea, lungs, heart, and diaphragm. The lungs are palpated. After removing the trachea, the esophagus is palpated for Cysticercus bovis. Near the aorta, the left tracheobronchial lymph node is found, and right on top of the bifurcation, the middle bronchial lymph node. The right tracheobronchial lymph node is located beneath the cranial lobe, which is bifurcated. The cranial tracheobronchial lymph node and the cranial mediastinal lymph nodes are also incised. Subsequently, the caudal mediastinal lymph nodes must be cut. Proceeding with the removal of the esophagus, we open the trachea with a longitudinal incision. This cut is extended into the main bronchi. Lungs which are intended for human consumption must be incised horizontally between the second and the lowermost third. Then we inspect the interior of the bronchi and the freshly cut tissue surface. The pericardium is cut open and spread upward away from the base of the organ in order to examine the epicardium. It's mandatory to incise into the heart in order to detect cysticerci. For this purpose, the interventricular groove, the right auricle of the heart, as well as the septum should be cleaved. By making an additional cut into the left auricle, we attain a better view of the endocardium and the valves. The gastric system of ruminants is examined separately from the intestines. Here the esophagus, the atrium of the rumen, the reticulum, the dorsal sac of the rumen, the ventral sac of the rumen, the omasum and the abomasum. The splenic lymph nodes are found between the atrium and the dorsal sac. Here we see the intestines. Duodenum, jejunum, cecum with the ileum just in front of the cecum, the descending colon, and the rectum. All gastrointestinal lymph nodes are normally inspected and palpated. They must be cut only in suspicious cases. Here we see the jejunal lymph nodes in their entirety. The connective and fatty tissue between the ileum and the cecum is torn in order to locate the cecal lymph nodes more easily. The anorectal lymph nodes are closely associated with the rectum. Now we turn the jejunum over in order to examine the jejunal lymph nodes on the other side of the mesenterium. The urinary and the genital organs are connected to the intestines. They're inspected only visually. The liver is surveyed with regard to its border, colour and size. The palpation is performed on a firm, smooth surface. Additionally, the gallbladder is inspected. The hepatic lymph nodes are located at the porta hepatis. They must be inspected. At the base of the left lobe of the liver, we make a perpendicular cut into the tissue. In the process, the bile ducts become visible. Lifting the caudate process, we make another cut down to the hepatic portal to make more bile ducts accessible. The diaphragmatic surface of the liver must also be palpated. The spleen must be inspected and palpated. In general, the kidneys, as well as their lymph nodes, are only examined visually. The renal lymph nodes are located in the triangle formed by the aorta and the renal artery and venae. In adult animals, the udder is checked next. In juvenile animals, this organ remains attached to the carcass because of its small size at this age. The examination of the carcass is the last part of the mandatory basic inspection. We pay special attention to the fatty tissue, connective tissue and muscles of both the exterior and interior of the carcass. In particular, the muscles of the pelvic quarter, the diaphragm, and the thoracic quarter must be examined. In addition, the joints of the pelvic legs, the tail and vertebral column, the sternum, joints of the thoracic legs, as well as the serosa of both cavities must be inspected. In an extended examination, we first check the interior lymph nodes. We cut through the coccygicus muscle vertically along a line between the caudal point of the split symphysis and the next to last sacral vertebra. Here we find fatty tissue enclosing the sciatic lymph node. The bend of the sacral vertebrae is used as an orientation point for locating the lateral and medial iliac lymph nodes. The iliofemoral lymph node is located on the body of the ilium. Subsequently, the aortic lumbar lymph nodes along the aorta are inspected. The thoracic aortic lymph nodes are frequently removed during evisceration of the plucks. We find the costocervical lymph node dorsal and craniomedial to the first rib. The cranial sternal lymph node is located on top of the manubrium of the sternum. The axillary lymph nodes of the first rib are reached by vertically incising the tissue cranial of the first rib. In order to find the deep popliteal lymph node on the external carcass, we dissect into the space between the lateral gluteobiceps and the medial semitendinosus. Here, the fatty tissue on top of the gastrocnemius contains the lymph node. The subiliac lymph node is located on a line between the patella and the tuber cocci at the cranial border of the tensor fasciae lati muscle. Following the dorsal border of the pectoralis profundus muscle, we next cut horizontally into the connective tissue and then the aponeurosis of the latissimus dorsi muscle. We then perform a cone cut at this location. Having removed this connective tissue, the proper axillary lymph node can be inspected. Just in front of the shoulder joint, the superficial cervical lymph node is located. It's covered by the brachiocephalicus muscle, which must be incised vertically. Having done this, we have completed the inspection of the deep tissue lymph nodes. The particulars of the case determine the time and purpose of the extended examination.